So what about these nerves and these drugs that we talked about? Here we have a sympathetic nerve varicosity. The nerve releases noradrenaline, and the noradrenaline acts at postjunctional alpha-1 and alpha-2 adrenoceptors. The noradrenaline also is taken back up into the nerve to be used again or resynthesized, and cocaine blocks that effect. So if cocaine is present in the system, then the concentration of noradrenaline will go up. Noradrenaline can also act on the prejunctional alpha-2 receptors to inhibit further release. So a drug like rowolsine would block the prejunctional alpha-2 receptors, and that would actually cause an increase in transmitter output. Tetrodotoxin, as we mentioned, blocks the nerve impulse coming down and can completely stop the nerve. I've listed 6-hydroxydopamine, tyramine, reserpine and guanethidine, and I'm not going to cover these in this lecture, but suffice to say that we have a vast array of drugs that act at the sympathetic nerve terminal, at the varicosity where the neurotransmitters are released. A vast array of drugs that we can use to interfere with transmitter uptake, transmitter release, transmitter regulation, packaging of the transmitter, and the generation of the action potential itself. And it has been the availability of these drugs and the position of the autonomic nervous system out with the central nervous system that has permitted our study and our understanding of the autonomic nervous system. The fact that we have access to it, and the fact that we have a wide array of drugs that can target various aspects of nerve transmission has made it very possible to understand in quite a bit of detail how the autonomic nervous system works. So that was a fairly quick tour through the autonomic nervous system. Things to remember are the balance between autonomic, sympathetic and parasympathetic, the fact that the sympathetic nervous system has noradrenaline as its main transmitter, not its only transmitter, that the parasympathetic nervous system has acetylcholine as its main transmitter, not its only transmitter, and the fact that we have lots of drugs which can interfere with the action of these transmitters at their postjunctional adrenoceptors and postjunctional muscarinic sites.